Hello and welcome to my channel. My name is E. I am a psychiatric mental health nurse practitioner, and in this video, I will be breaking down antisocial personality disorder. And this is going to be from a practical standpoint based on my experiences throughout my career. I know antisocial personality disorders, sometimes the traits might mimic other disorders in the DSM-5. Therefore, providers I've seen sometimes confuse antisocial personality disorder for bipolar disorder and other types of disorders. But there are some distinctive differences that make each disorder stands out. And sometimes these might come with time in practice. You'll be able to identify them. So this is going to be from a practical standpoint, not necessarily textbook, just giving you like real life experiences of what you might see with someone with antisocial personality disorder. Patients with antisocial personality disorder, this presents in childhood. You usually start seeing traits from childhood. Sometimes they are diagnosed with conduct disorders in childhood, but let's say someone never saw a psychiatrist or any mental health provider and was never diagnosed. That doesn't mean they could not have antisocial personality disorder. Maybe they were never seen by a professional to get diagnosed. So you have to do thorough evaluation, assessment from childhood, obtaining that history to see what their behavioral patterns were from childhood and to assess to see if they meet the criteria for ASPD. So let's start. Patients with ASPD experience a lot of trauma in childhood. These are patients that probably experience neglect, physical abuse, emotional abuse, and all forms of abuse you can deduce that a child could experience from childhood. Sometimes their parents do drugs, sometimes they are taken away from home for safety reasons and then taken into one foster home, and then the abuse continues. I've had patients who have been through 30 foster homes in childhood. So these kids experience a lot of trauma in childhood. And as a result of that, their brain is actively in a fight or flight mode because they're always in that survival mode. When and where am I going to get my next meal? Maybe their parents aren't around. They have to go to the streets to look for how to get their next meal, how to get money to buy clothes. So they are always in that mode to fight for themselves because the adults that they should trust as a child, maybe it's mom, maybe it's dad, people that I should trust with my emotions and feeling to be able to provide security, aren't doing that or probably aren't even there. So I, as a child, am put in a position where my brain has to automatically fight for my survival so I do not die. As a result of that, areas of the brain that deal with love, comfort, emotional security, emotional regulation, those areas are not active because remember, those kids have no comfort, have no security. So that area in the brain remains dormant. The parts of the brain like the amygdala, the fear centers of the brain, it's always on active mode. And as a result of that, the brain is like a muscle. When you use something too much, that part of the brain expands. So kids with antisocial personality disorder or people who have experienced a lot of trauma in childhood, when they do like a brain scan, you can see certain areas of their brain are more expanded or have more growth than other areas of the brain. So once you use something, it tends to multiply. So the areas of the brain, like the fear centers, those neurons in that area tend to multiply because that's where it's most active. And kids with ASPD that show the traits in childhood, they have a lot of behavioral problems. In fact, we would say conduct issues. From childhood, you can see that in school. How are their behaviors in school? They do not like authority figures, very defiant. Because remember, the authority figures they had as kids never protected them, so why would they trust somebody else? So they have a lot of issues with authority figures. They don't want to listen to authority. They're always fighting sometimes. They've been expelled from school, using drugs to numb their pain, the trauma they've experienced, drugs to be in that survival mode. Um, Fighting. Usually, these kids have moved from multiple schools or get kicked out of schools, alternative schools, or sometimes they just eventually drop out of high school. So, a lot of problems in high school. And then also evaluate their lifestyle in the community. Usually, they grow up, like I said, in poverty stricken area, a lot of crime. So, they find themselves being involved with crime, sometimes gang related activities, um, stealing, hurting animals, burning down buildings, just breaking the rules altogether, just being like an outlaw. And the patients will tell you, I'm an outlaw. So they just are out there fending for themselves. They believe most of the time in making money like the fast way because that's what they know. So you see a lot of conduct issues from childhood, and then you can see that they struggle with emotional regulation. They struggle with remorse. They can see something that could um, cause like a visceral emotional reaction from regular everyday people, but they might not respond the same way to those instances. So they have a hard time relating with people emotionally. They have a hard time um, with remorse, showing remorse. Usually they move on from one thing to another. Something might happen and they barely grieve or have any guilt. They just keep moving on from one thing to another. So once these patterns, you can identify them in childhood. Sometimes they are also in juvenile centers in childhood because they start involving themselves with breaking societal norms from childhood. So once these patients become adults and these behavioral patterns still persist, then you can diagnose them with antisocial personality disorders. So there must be identifiers of conduct behavioral patterns in childhood. And then once those patterns continue into adulthood, you can diagnose them with antisocial personality disorders. So from like the age of 18, 19, 20, if this patterns continues, you can mature the diagnosis to antisocial personality disorder. And let's talk about some of the traits that you can see with patients with antisocial personality disorder. We already talked about the fact that they break societal norms. They call themselves outlaws. They hate rules. They don't like abiding by any rules. They don't like being told what to do. They struggle with authority figures. I always say they like to march to the beat of their own drum. They don't like people telling them what to do. They want to do things their own way. They are very manipulative and deceitful because remember, these are individuals that in childhood they had to probably deceive in order to get their next meal. They probably had to fight, or like in foster homes, sometimes they were in group homes. You are there with other kids that come from similar backgrounds. You have to fight in order to be able to see the next day or have your next meal or have somewhere to sleep. So they know how to deceive and manipulate others in order to be able to get what they need. So you have to be tactical and identify the manipulation tactics from a mile away. And then they struggle with regulating their mood, like I said. So most of the time they have a very short switch. Their mood changes. They might be fine one moment and then little things might trigger them, and then they become very agitated, irritable, aggressive. So they have a hard time regulating their emotions. They get angry easily. They struggle with anger, and they are also very impulsive. Usually, they don't have the time to sit down and process. Remember, these parts of their brain are not very active, so they don't have the time to sit down and process, okay, what's going to be the best course of action. So they are very impulsive in their behaviors. They are quick to act before thinking. Reckless decision. It's like, I'll rather get you first than me. That's their mindset. I'll rather get you than me. So whenever they sense fear or danger, their mindset is, I'd rather get you than me. And they might, hurt people and really not give a damn about them because they have no emotional ties with people. And although they struggle with remorse and emotional connection, that doesn't mean they don't really care about like their loved ones, right? Because sometimes some people might feel like, oh, that means they don't really give a damn about nobody. They might care about their child or their mom or their lover. They just struggle to relate with people emotionally, sometimes communication, always arguing and things like that. But when it comes to people other than people that are very close to them, they don't really care. They don't really give a damn about people like that. um Usually they will say things like, I'm loyal to those that are loyal to me. I'd rather get you first than me. Or they'll do anything for their survival. If they have to fight to kill to get what they need to get, they'll do it. If they feel betrayed, they feel hurt, they don't mind taking anybody out. Because remember, this all stem from childhood. Fear, fight or flight. I'd rather get you first than me. So these are the core traits of patients with antisocial personality disorder. And what is the treatment for antisocial personality disorder? The big and top treatment for antisocial personality disorder is therapy. Because remember, this disorder is a personality disorder that developed based on childhood experiences, based on trauma. So it has to take a lot of therapy to teach them how to relate with people, to teach them how to communicate, to teach them how to emotionally regulate, to teach them not to be deceitful, manipulative, um, to relate with authority figures. So it takes a lot of intensive therapy to change these behavioral patterns that were developed from childhood. And in combination with therapy, you can add psychotropic treatment for patients that need it. Patients who struggle a lot with aggression, always getting in fights, um, anger, hurting people, violence to the highest form you could think of. Sometimes they might need psychotropic meds to help them regulate their emotions, the mood swings that they experiencing. Some patients might be open to it, some are not, because remember, they do not identify that their patterns are problematic to them because they're always in that fight or flight mode. And some of them want to stay like that because I want to be alert at all times. Some of them might be open to medications to help them with their anger and aggression, while others might not. So, when the top treatment for antisocial personality is therapy, as well as psychotropic medications, if need be. You can supplement therapy or combine therapy with psychotropic medications. These patients need a lot of support. They need to learn that they don't have to always be in that mode of fighting or fleeing. So they have to learn that I feel safe, I feel secured, and it takes time. And I always tell patients, remember, it took you so many years to get to this point, and it won't go away in a day, in a week, or in a year. It's going to take active treatment, active therapy in order for you to improve these patterns. So that is my little spiel on antisocial personality disorder from a practical standpoint based on experiences. So these are some things that you can see in patients with antisocial personality disorder. If you have any questions, you can ask them down in the comment section below. And I will see you again on the next one. Thank you and take care.